Hello guys, this is Brian here with a video. A couple of days ago I posted a video about Blue Cross Blue Shield's policy fixing to change about emergency room care visits. The news story that I posted on here is not really accurate because I did some digging. And that news story was just sloppy. It really was. It was just, I don't know who's in charge of Channel 5 or whatever the case may be, but it was really inaccurate reporting. Because guess what I have? I have Blue Cross's memo that Dallas Morning News attained. And I'm going to read it to you. Now, I did some research on this before making the video, and I did some research last night. Blue Cross has not one word of mention about this whatsoever on the website. So I thought first, where in the hell did the news station got their information from, right? I did some Googling, and it turned out that Anthem out in California had a class action lawsuit. Something similar to this, about people's benefits were changed in the middle of the year. And usually people's contracts start from January 1st through December 31st on the individual market. And Anthem they were caught changing things mid-year. People deductibles went up, even though after they met out of pocket and things like that. So they had a class action lawsuit and they won. But it seemed to me that Anthem was the worst offender of this little emergency room, little discouragement for people. And I just went on Dallas Morning News and see if I was able to find anything. And they actually did some articles for the last couple of days. And they attained a memo. So I'm going to read it to you. Because that news story is not 100% accurate at all. And the way they worded it, if I remember correctly, is it was going to affect all of Blue Cross's members. And that's not correct at all. Now, this only applies to the HMO, apparently. Somehow it doesn't apply to PPOs, but probably will sometime in the future for cost-saving measures. After reading this memo, and I'm going to read it to y'all, I kind of think that this is really unethical, on the verge of being illegal. Just really unethical and being shitty to people. But let me read you the memo. Dated April the 18th, 2018. Learn more about our HMO emergency benefit management process. Some of our members are used in emergency room for things like head lice or sprained ankles for the convenience rather than serious life-threatening issues. Doing so not only drives up costs for our members, but uses limited emergency room conditions use of the emergency room resources for conditions that are not serious or life-threatening. We want to make healthcare affordable for our members, and to do so, we have to be good stewards of their money. Bullshit, 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 bullshit. Blue Cross has always used that line. We want to make healthcare affordable to our members, and to do so, we must be good stewards of their money. Bullshit. Let me explain. A little sidetrack here. If they were good stewards of the members' money, they wouldn't allow the old CEO of Healthcare Service Corporation, who owns Blue Cross in 5 states, to retire with a $10 million payout. They would not pay millions of dollars to their executives as a non-for-profit, and they wouldn't be paying millions of dollars to their presidents of each state. They operate in 5 states from Healthcare Service Corporation. Blue Cross of Texas, New Mexico, Oklahoma, Montana, and Illinois. And Healthcare Service Corporation is the big kahuna out in Illinois. So no, they're not good stewards of their money at all. Actually, they're really, to me, they should be sued for malpractice, really, for mishandling members' money. If they were good stewards of money, okay, you don't believe me on this part. Believe me on this. You don't believe me on previous parts. Let me to put you on this part. Explain this part. If they were good stewards of people's money, why are they sitting on $10.5 billion in reserves in the bank that's not benefiting nobody except them? Where do you think that money came from? It came from people like me, or people who have Blue Cross, paid into the system, and it's sitting there. So therefore, in theory, that the premium should be lower because they're non-for-profit versus a for-profit health insurer like Aetna, United, and Cigna. So why in the hell are they sitting on $10.5 billion with a B billion dollars and then turn around and cancel PPO policies if that's being good steward of members' money? I don't believe so. I think they should be yanked. Their tax-exempt status should be yanked. I think there should be a class action lawsuit. And I think they need to be hauled in front of the Congress to explain why they're hoarding this money. Supposedly, it's there for a rainy day fund. Well, Obamacare is a rainy day right now. So why is their PPOs being canceled? Go figure that one out. What you need to know. It says, starting June the 4th, 2018, our fully insured group and retail HMO members may be required to pay the entire emergency room bill if they go to out-of-network emergency room provider as convenience for a condition they don't think is serious or life-threatening. The key word is, or keywords, out-of-network emergency room. The news did not mention that one damn bit, did they? Sloppy work. You know, no wonder Trump has it right. The media is so fucked up, it's unreal. You can't trust one word they say. You have to get your news, you have to watch the news on multiple channels to at least get some of the story right. It says, on May the 1st, 2018, we will send letters to members who had a out-of-network emergency room claim. Let them know more about care options. See details below. Did the news say it was going to apply? They sounded like it was going to apply for everybody who had Blue Cross, not people who went to out-of-network emergency room. The review process for claims occur after June the 4th, 2018 will be to request medical records and an itemized bill for the claim, review each medical record to ensure services our members receive are being accurately billed to eliminate improper charges. As part of the review, the members' symptoms and concerns will be reviewed in connection of their HMO plan. Now, since the insurance company does not have a contract with the out-of-network provider, that out-of-network provider can really, in reality, somewhat fudge the bill and get away with it. Now, if it was an in-network provider and they have a contract with the insurance company, oh, you betcha the insurance company will step in and tell them to fix that immediately, because they don't want to be on the hook. They don't have they have a contract with them. So really, they can't fudge the bill because the insurance company will come after them big time. But out-of-network provider, because they don't have a contract, you are ultimately responsible for that bill. Now, this next part is kind of skirting the Texas prompt payment law, now which I will explain in a minute. Claims will be impending and not denied. Claims while we review the claim. Review each claim using the multi-step processes involved. Well, here in Texas, the Texas Department of Insurance has a law called the Texas Prompt Payment Law, and I think it's been 10 to 15 years old, I think. By law, once a provider submits a claim to an insurance company, they either have to pay the claim or respond to a claim within 4 to 5 calendar days. Then they will have to send a letter out to the member and the provider, letting them know we need additional time to process the claim, so on, so on, so on. It just cannot be impending forever and ever and ever. There is ultimately a deadline the insurance company either pay it or deny it, or whatever the case may be. So they kind of try and skirt the prompt payment law here. A claim will not be denied without review by a licensed physician. Well, who will be the licensed physician? Is that licensed physician going to be an emergency room or emergency medicine doctor? Should the claim be denied, the member will have the same appeal rights that they currently have. I don't know. I bet you $5 or somehow if a claim has been denied and Blue Cross sends letters to to the member. Oops, we forgot to include the appeals process letter. Oops. Yeah, I bet that happens too. And member communication details below. The letters are being sent on May the 1st, going to members who had an out-of-network emergency room claim. It will explain the claims review process and their care options. We want to make sure members receive the right care at the right time at the right place for the best health outcomes. We have spent the last few years educating members, which is really a brainwashing operation, and goes to these couple different websites here. A similar message will go out to employer groups. Please continue to educate your clients on the role of controlling the cost of health care and options where to get care. Now, like I said, this is on the verge of being unethical. It may be illegal. I'm not an expert, but kind of sounds like it. But here's a little paragraph I'm going to read from the Texas Department of Insurance about HMOs. It says, what determines whether an HMO has an adequate health care delivery system? All covered health care services that are offered by the HMO shall be sufficient a number and location to be reasonably available to accessible within a geographic service location. HMOs must have a sufficient number of primary care physicians and specialists with hospital admitting privileges, participating facilities who are available and accessible 24 hours a day, 7 days a week, within the HMO's geographical service area. Additionally, an HMO shall make emergency care accessible 24 hours per day, 7 days a week, without restrictions as to where the services are rendered. That is according to the Texas Department of Insurance. Also, for those who don't know, HMO must arrange and make available routine care within 3 weeks. I didn't know this till I looked this up. For routine medical conditions, 8 weeks for non-emergent dental conditions, and 2 weeks for behavioral health conditions. So, I think the Texas Department of Insurance needs to investigate this. Now, I don't like the fact that insurance company is telling people how to get care. I don't like that. That's not really their place to tell somebody, hey, your conditions not warrant emergency room care. That's not the insurance company's place to do that. Because that's really, if you go down that road, down that slippery slope, basically you're telling people the member has to be their own doctor and diagnose. No. Now, we all know, common sense does tell us, that yes, head loss is not an emergency room situation. Now, sprained ankle, maybe, because you don't know if you broke your foot or not. You probably have to get an x-ray and all that. But head loss, yeah, we can understand that. Maybe, sniffles, and maybe a little tiny cut on the hand. But other than that, that is not the place of the insurance company to tell somebody that it has to be life-threatening, so you better make the right decision or you'll be financially ruined for the rest of your life. No, that's not their place. And that really makes me angry. Now, why don't they just educate the people? I don't know where Blue Cross is really getting this from, but why not educate the people instead of doing this? Just educate them and say, use an in-network facility and network, and you won't, you know, your financial responsibility will be lower versus out of network. Now, as far as I remember, even prior to Obamacare, I don't know if it's a state law here in Texas. Now, I do know Obamacare got kicked in, and I think it's now nationwide. But if you go to a out-of-network emergency room or wherever the case may be, the insurance has to pay them in-network benefits. Now they can bet the out-of-network provider can balance bill you to the sky, but the insurance company, like for instance, if you had a $500 deductible for in-network and a $3,000 or $5,000 for out-of-network, it always applies for in-network benefits for emergency room situations. Because you really don't have really choice, not really in that regard. Also, for those who don't know, and I don't know if this is a state law, this is really regarding about, this is just a standard operating procedure for Blue Cross here in Texas. If you go to in-network hospital and you had surgery done, where the case may be, and like the anesthesiologist or pathologist or out-of-network, they had to pay them in-network benefits. Now they can balance bill you, but they had to pay them in-network benefits. I found that out on my own last year. Because Blue Cross does maintain a list of services available at their network hospitals. But while I was researching this, they're saying that some provider groups and hospital associations out there are going to sue. In some other states, they have sued the insurance companies for this, and the Dallas Morning News kind of hinting around that they think they might do it here if this goes into effect. To me, that's really doing people shitty. You know, you can have a stomach ache and it turn out to be your gallbladder's fixing to rupture or your appendix fixing to rupture. You don't know. It's not right to tell people to make that judgment, because you don't know what's going on really, and you don't know what's going on in their head. You don't know the symptoms. They're not a qualified medical provider, a medical doctor. You know what happens if the person did get a cut on their finger and they were on blood thinners and they just keep bleeding and bleeding and bleeding. See, so in my view, it's not the place of the insurance company to tell you where to get about emergency room care. It shouldn't be on the members' backs like that. No. But my other point of the video is, see how sloppy the news station did their little story, and I just took a couple, maybe 30 minutes out of my time and found out all this information. But I posted links to the articles and also to the deal from the Dallas Morning News. But I'm really, really thinking about filing a complaint with the Department of Insurance. Somebody needs to let the Department of Insurance look into this. To me, it's kind of illegal, unethical. They can't restrict care for emergency. I read the paragraph to you. They can't restrict care where you go for emergency room situations, because once the ball gets rolling on these little changes, other things will come down the pipeline and affect everybody. So I don't know. I'm really seriously, if you think I should file a complaint, let me know in the comments if I should file a complaint with the Department of Insurance. Because to me, this is just unethical. And it's really, even though it doesn't affect me, but it could affect me down the road. You see, they could just say later down the year or next year, say, oh, we're going to make it effective for everybody. That's not right. So, talk to y'all later.